Hello, everyone, and welcome to the Babies in Common Show. I'm Jeanette.
And I'm Melissa. Welcome, listeners. As a reminder, any information shared during the show should not be taken as medical advice. Please consult your own healthcare providers and visit babiesincommon.com/disclaimer to read more.
Today is Wednesday, September 10th. We are already into fall, which is
Oh my goodness.
mind-blowing, but good. And we're going to not have a guest today, a change of pace from all other episodes. And today we're going to be answering your questions about birth.
Yay!
Well, maybe not yours. If you're one of the listeners right now, you might not have submitted one, but questions from members of the Babies in Common community who submitted questions via email, Facebook, and direct message. And we're going to have fun with it. So maybe
I'm excited. Thank you for everybody who answered our call for questions on our last episode and visited our social media pages. So, all right, let's get started.
Yeah, cool. We've got some good questions coming up about breastfeeding too, but that's for next week. And
oh, that's right. Ask us anything about breastfeeding next week. It's ask us anything about birth. No topics off limits.
Ooh, one question that wasn't asked was sex. Ooh.
Well, I'm
Let's
always
start
game
with
for
that.
talking about sex.
Let's start with that. Can you have sex when you're pregnant? And if you're heterosexual or, well, any toy, we could put it that way, will sexual intercourse with something that's long, human or otherwise, bump the baby's head?
Ooh, good question. What do you say, Jeanette?
Absolutely not. And if you are so long, or if your partner is that long, or whatever you're using is that long, there's still a lot of protection between the baby's head and the thing that you're placing inside your vagina.
Absolutely.
Lots of cushion. Whoops.
And you watch the video.
Prop.
I've got my prop here, my uterus, and the cervix is just the bottom third of the uterus when you're not pregnant. And then, of course, as the uterus grows, the cervix stays tightly closed. It's a very tight muscle, and it's about 4 centimeters long. The baby's protected by that, but also by the amniotic fluid, the thick muscle of the uterus, et cetera, et cetera. So,
and it feels like your nose, like it's pretty strong. So if you touch the tip of your nose and press it, it feels kind of like your nose.
Absolutely. And so even, if whatever object you were using, human or otherwise, was to bump into the cervix, it would not bump into the baby, as a cartoon has shown. So while, having sexual intercourse or stimulating sexually, releases oxytocin, and oxytocin does stimulate uterine cramping sometimes for people with a uterus. And so that can be uncomfortable. So orgasms can cause some cramping, but unless you are high risk for preterm labor and have been specifically told by your medical provider that you cannot have penetrative sexual experiences, or using a vibrator, for example, any type of sexual stimulation or nipple stimulation, unless you've been told that specifically because you have an issue with your placenta or with preterm labor or bleeding, then it is normal, healthy, good. There's even some evidence to show that people who have regular sexual intercourse in pregnancy keep everything loose and elastic. So I say it's never a downside if you're up for it.
If you're up for it, yeah, go for it. Cool. So another question was, do I really need to restrict my diet during pregnancy? What say you, Melissa?
So what do you think they meant by restrict, Jeanette? Do you think they meant restricting types of food or restricting calories?
I think they meant restricting types of food. I hope so, because we shouldn't be restricting calories.
Definitely.
Not that you need 5,000 calories a day, for sure. It's only
right.
a little
bit of
extra.
It's not eating 4-2. It's only about 300
just
extra
like 300,
calories a day.
Yeah. Sometimes we use that as an excuse, though. Like, well, I'm pregnant, I'm eating for 2, and you may grow to regret that later. grow to regret
an
that.
intentional pun in that one?
Yes. But otherwise, types of foods that you would limit or not eat while you're pregnant. What's the updated
So when I
info?
counsel prenatal patients as an RN, as a nurse, I always say that there's really 2 types of categories of foods that we caution women against eating in pregnancy. One are types of food that in and of themselves could cause harm to the baby. And this category of food is very, very tiny. So things, for example, with an exorbitant amount of vitamin A, like goose liver, large excessive amounts of vitamin A can cause problems with the baby's eye development. So no goose liver, no pate for you pregnant people, right? But other than like toxic chemicals, there are not a lot of foods that in and of themselves can cause physical harm to the baby, right? So then the other categories of foods that people are usually thinking about when they ask this question are foods that could potentially be infected with a organism, microorganism like a bacteria that could cause you to get sick. And then that illness could cause birth defects, miscarriage, et cetera, et cetera. And so those are things like listeria, and whatnot. And that's where the cautions against eating soft cheeses and lunch meats and things like that come from. All right. So there's a really good book by Emily Oster called Expecting Better: Why the Conventional Pregnancy Wisdom is Wrong and What You Really Need to Know. And I highly recommend it. It's got a lot of great information. I'm not going to go into great detail because it's a great book to read, but it basically talks about how, there are certain risks to different things that we do in pregnancy. And, you as the pregnant person can choose to accept or not accept those risks or judge how much of a risk it actually is. So, for example, the soft cheeses came about when, most American grocery stores did not carry soft cheeses from, at all, or if they did, they were imported from other countries in Europe and they might not have been pasteurized and whatnot. But, there's a lot of like blue cheese, for example, now that actually is pasteurized, or if it's cooked in the food that you're eating, it's going to kill any potential pathogens. And then I always, feel badly when people would call me and say things like, oh my God, I had a turkey sandwich. I was starving. I had a patient once who was like, I was at a conference. That was the only thing that they had to offer. And I was so hungry. Did I harm my baby? And I'm like, well, are you ill? She's like, no. I'm like, any signs of illness? And she's like, absolutely not. I'm like, well, then that lunch meat didn't have listeria. Hooray, you're
Bing,
fine.
bing, bing,
So it's
you
not
won.
that the lunch meat itself is going to cause birth defects. It's that if that lunch meat happened to have listeria, which is serious but rare, it could have caused a problem. So I definitely recommend, not just accepting those age-old pregnancy wisdoms at face value and kind of doing a little bit more research on it because, for example, they tell you not to eat sushi in the United States, but in Japan, that's, fish is a regular part of the diet of pregnant women over there. So how are they preparing their fish so that they know that it's very low risk that they could get sick? So that's a very great question. Do you have anything to add to that?
I think just with the fish issue is looking for wild caught fish is typically a good guideline compared to farmed. I had somebody tell me the other day, a couple weeks ago, it was a dad, and he was like, oh, I thought it was farmed fish that was good. And I was like, no, actually, it's the opposite. So he got him confused. And that's, at least he was paying attention, but we want to
Sure.
avoid that more than we want to avoid the farm fish whenever we can. Tuna, like once a week, but there's definitely some tuna that are healthier than others. And just doing a little research on it. So, but again, it's like you said, it's not a lot of foods. So it's not a huge limited diet for sure. Enjoy life.
So I'm going to throw the next question your way, Jeanette. How do we make safe choices about medications during pregnancy?
You consult with your care provider. Super important. And oftentimes they are pretty good at seeing what the research is on what aspects of medicines, what dosages too, are going to cause a problem with the pregnancy or with the baby or link to some problems that are associated with that medicine. And it changes all the time. There's new research that comes out all the time where, you'll see people who are like, oh my God, I was on that for a year. It's like, well, now they've seen that some people had associated problems with it. And it's really, really different. We'll talk about this next week, but it's really, really different in pregnancy than it is for lactation.
Absolutely.
There's a lot more medicines that you should be trying to avoid whenever possible when you're pregnant. Then there's a lot more medicines and drugs that you could take and would be safer for you when you and your baby when you're nursing or lactating. So definitely. What about you? What do you think?
Yeah, I agree. I would also like to say that while I think that your standard obstetric medical provider is probably a good guide for you as far as what medications are safe to take during pregnancy, as we'll probably talk about more next week, they are generally not a good guide for what medications are safe to take during lactation. So that's a completely different thing. So with that aside, I'd also say make sure to ask your actual OBGYN nurse or midwife or doctor and not the pharmacist or the dentist or anybody else that isn't in obstetrics. Because when I worked an OBGYN office nurse, I'd often get calls from people that were told by a number of different, very educated medical professionals that they couldn't take very benign things. Like I've had people been told they can't take Chloraseptic, they can't use
Mm.
cough drops, they can't, take Tylenol.
Mm.
And so, again, I'm not saying that people should reach for a pill before trying other comfort measures first. I think that's a good kind of basic guideline in pregnancy, that whatever ailment you're having, try non-pharmacological comfort measures first before a pill. That being said, there were times that my headaches were so bad when I was pregnant that I
Mm.
couldn't function. And so if I had already tried an ice pack, and I tried, the peppermint essential oil on my temples, and I tried drinking, and I tried a dark room, and I tried all these things, and I needed to function because I had to take care of my children, I would take a couple Tylenol, and so everybody has to make the decisions that work best for them. But oftentimes women are told really ridiculous things, like they can't have dental work when they're pregnant, which isn't
Mm.
true, or they can't take, very mild comfort measures like using, a heating pad. I've had people being
Oh
told they
my
can't even
gosh,
use a
right?
heating pad when they're pregnant. And it's like, so don't just listen to any old Joe when it comes to what medications you can take while pregnant.
I think it's also good to add here, like alcohol. So, depending on which country you are pregnant in, they may have looser guidelines about drinking alcohol. And so, we need to be, of course, careful not to drink a lot of it or frequently. But I think you make your own decisions in consultation with your care providers, talk about like what the concerns are. But it's also that, especially when it comes to labor, this is the part that always gets me. And people, I'll say, like, have a glass of wine or half a glass of wine while you're in early labor. And they're like, I can do that? I'm like, you could show up at a hospital and get some really hard drugs right now.
Right.
You can have a glass of wine when you're in labor.
Well, the thing is, I mean, fetal alcohol syndrome is serious and not
Right.
to be taken lightly. And if people are regularly drinking during
Right.
pregnancy, that is a problem. We have a lot of research on that. That being said, at the end of your pregnancy in your third trimester, if
Mm-hmm.
you're in prodromal labor
Yeah.
and need to sleep, guess what? If you
Prodromal
go to the
meaning it's
hospital,
lasting hours and hours and hours without
exactly.
any progress.
Right. Last exhausting contractions that are not strong enough to cause progress, that are just making you miserable and tired. If you go to the hospital, they're going to give you morphine,
Mm-hmm.
right? Which we know crosses the placenta. We know has effects on the baby. And so, one glass of wine at that point is, if we can't forget to keep things in perspective as far
Mm-hmm.
as, well, what's the alternative? The alternative is narcotics,
Yeah.
right? So one glass of wine is not going to cause fetal alcohol syndrome in the third trimester. Absolutely. I think that's, everybody has to make informed choices for sure.
And not to even be trying to hint that morphine's not an appropriately used drug sometimes for people in labor.
No,
It can
it's
be,
every
absolutely.
medical
It's
intervention
just
has
if
medical
wine
necessity.
works first, that's just a fermented grape. Like that's a more quote unquote natural method that if that makes you feel better and helps you get some rest, then that's a great alternative from a pharmaceutical.
I mean, if you want to get into the history of it, they used to do alcohol drips on pregnant women to stop preterm labor. So, I mean, obviously that was not safe in the long term. We have safer drugs now like magnesium, but
Mm.
so that's actually if your grandmother was in preterm labor and you're listening to this, she might have had a little ETOH, like an alcohol drip into an IV to stop her preterm labor. The other thing that's kind of a side note about this, and it goes with diet and with medication choices, but I get a lot of questions about kombucha.
Mm-hmm.
And people saying like, well, you definitely can't have kombucha because there's alcohol in it. I
Mm.
mean, the amount of alcohol in kombucha is so minimal. And some people are really, really, I mean, everybody has to make their own decisions. I'm not giving anybody medical advice right now. But from fermented foods in general have so many benefits for you when you're pregnant or just in general in your life, whether that be kimchi or sauerkraut or kombucha or kefir
Mm-hmm.
or whatever. And so, I mean, a small amount of kombucha that is not even alcoholic enough to be, it can be sold at the grocery store. It's not
Right.
considered an alcoholic beverage. Is that really what we're concerned about? Just a small amount
Mm.
of kombucha a day when it has so many benefits. So just something to think about.
I didn't even know that until recently. I was actually shopping for alcoholic drinks with friends. It was probably pre-pandemic by this point, of course. But And she was like, "Oh, I don't really drink, but I do like this one kind of kombucha and this one specific." We're in the grocery store, but like this one specific flavor of this one company has the most alcohol, and so that's what she was choosing. And I was like, like never heard of this before, you know? I was
Right.
like, okay, interesting. Have to try that.
I
And it
mean,
was yummy,
technically,
but
orange juice has alcohol in it
right.
too. Any fruit juice will, can start to ferment and get a little bit of alcohol in it. So, but I don't think anybody's getting drunk off virgin screwdrivers.
Man. So
Speaking of
speaking of
juice,
drinking things, yeah. So there's
Jeanette,
this glucose test
yeah,
that is very, very sugary that many people are encouraged to drink.
you're talking about the glucola, dun
The
dun dun,
glucose,
which
and
I have heard tastes like a really, really bad melted freeze pop. That's what I've heard many people describe it to me as that.
I took it, and I would say it tastes like overly sweetened orange soda.
Okay.
The one I had, anyway. Um, but yes, so somebody asked, are there alternatives to the glucose test? Now, first of all, the glucose test is used, can you explain, for the
So
determination of?
gestational diabetes. So she's probably talking about the GCT, the glucose challenge test, which is a screening test for gestational diabetes. Standard of care in the United States is that around 24 to 28 weeks, you would drink 50 grams of glucola. Sorry, a bottle of glucola that has 50 grams of carbohydrates of simple sugars in it. It tastes very, very, very sweet, of course. And then we draw your blood an hour later and we see if your levels are elevated. And that can be, if they are, it can possibly mean that you have gestational diabetes. And if you fail this screening, the recommendation is to go on for what's called the GTT, which is a glucose tolerance test where you actually drink 100 grams of sugar, and they dry your blood fasting at 1, 2, and 3 hours. And if you fail 2 or more of those values, then you're considered to be having gestational diabetes, which we're not going to get into, but does have, if someone truly does have gestational diabetes and they are not keeping their blood sugars in good control, it has many risks to the pregnant person and the baby. So it's important to know if you have it so that you can change your diet about it. But Jeanette, are there any alternatives to taking that sickeningly sweet,
Mm,
full of orange food dye glucola? Because
oh my
I've had a
gosh.
number of people pass out after taking it,
It's
and just
super,
get really,
super
really
sweet.
sick, and then they vomit it all up.
Yeah,
And it's like not helpful if they vomit it all up and I can't draw their blood. So
yeah.
what have you heard?
I also remember being really frustrated that I had to take that, especially my first pregnancy, because I was being much more healthy than my second one. And I was not having sugar my first pregnancy. So I was like, this is stupid. Like, I don't even have sugar. And they're like, well, that's not the point of it. And I'm like, but it's kind of like, it was very frustrating to me because I was so not used to that by that point. But yes, there are alternatives, especially because it's got so many food colorings in it. So 10 ounces of white grape juice is the same as 50 grams. And I don't know
Yes,
the exact,
specifically white grape juice,
I think
not
if
purple grape
you're,
juice.
yeah, and I think Jelly Belly, I want to say brand jelly beans, if there's like
I
10
think
or
it's the
12, what is it?
Brock's.
Is it
Brock's,
Brock's? Okay.
yes,
Oh, it's
jelly
the big ones.
beans.
Okay.
Yep.
And then I know one midwife who will recommend that her clients do pancakes and syrup. I'm sure there's some sort of measurement to that too. But yeah, there's alternatives. There is also the alternative that some people will do, and actually you might be more updated on this than I am at the moment, where they'll actually just say, hey, why don't I just take home a blood glucose monitor for several days and monitor and write down my blood sugar numbers. What's the update? Is that still something that people are doing?
Yeah, so I mean, it's hard because and this comes up a lot. There's a difference between public health and personal health,
Mm-hmm.
right? So on a public health level, we have 4 million babies born a year in the United States. And so when we're making public health guidelines and public health policy, we have to take into consideration all these different types of people from all races and all socioeconomic statuses and all resource levels and whatnot, all levels of health or not, or illness, right? Some people have chronic illness when they're pregnant. And how do we standardize something like screening for gestational diabetes? So what they've come up with is this, 50-gram glucola that is the same for everybody. And it's not going to be that your pancakes are bigger than my pancakes and your syrup is natural and your syrup is high fructose corn syrup and everybody's body does different types of sugar in different ways. It's going to be standardized, right? So there's something to be said for standardization. However, you are an individual person who can make individual risk benefit and alternative conversations with your provider, and have a conversation like, well, this isn't something that I normally, would consume. I generally don't have this level of sugar in one sitting. I would like to really see how my body would react to just the normal foods that I eat, and taking maybe a fasting blood sugar in the morning and then a blood sugar level 2 hours after each of my meals, breakfast, lunch, and dinner. And if those levels with my normal diet are elevated, then I would like to be counseled on how to, what we call counting carbs, to control your diet, to try control your blood sugars with diet, which most people with gestational diabetes can. Only a very, very small amount of diagnosed gestational diabetics need insulin or other like oral anti-diabetic drugs. So most people, with just being smart about their carbs, can, when they eat them and pairing them with protein instead of just eating straight carbs, and slower to digest carbs instead of simple carbs, can control their blood sugars and have very healthy pregnancy outcomes. So, I mean, I think that might work for some people. Is that something that's going to work for 4 million people, to have everybody take their blood sugar 4 times a day for a week? No, but that might be something that you're motivated to do. And so I think it should definitely be something you discuss with your provider if you are interested in an alternative to the glucose test. And just keep in mind that, again, it's your body, your choice. And so if you would like to just explore different avenues to get the same answers, right, go for it. It's definitely worth a conversation.
Yeah. The one other thing to add to that too is that there are some providers that will tell you that if you're gestational diabetic, even if it's controlled via diet, that you need to be induced at a certain time period. Or like I remember working with a couple different couples as a doula years ago, and I was working with both of them at the same time. So they were like due within the same couple of weeks or something, and both of them were on a low dose of insulin. And one of the doctors was like, we're going to see. I'm hoping you go into labor by 40 weeks. And the other was like, absolutely not. You're getting induced or having a C-section by 38 weeks. And it was fascinating to me. And they were both healthy people otherwise. And I was like, wow, these two people have really differing providers. And I've seen that across the board, that, sort of look at what the updated evidence says and sort of apply it to your situation, because sometimes induction does make sense. And sometimes you might negotiate that a little bit and say, well, in my situation personally, here's what's happening with my health. What do you have to add to that?
I totally agree. I think that it's something that every pregnant person should hear, that providers, doctor to doctor, midwife to midwife, family practice to family practice, have different ways of playing out those guidelines. Whatever your doctor says is not going to be the way that every provider practices, or whatever your midwife says is the way it is not necessarily the way that everybody practices. Guidelines are guidelines, and then you can make, if the providers can make a personal recommendation based on your health, your risk factors, your family situation, by following the guidelines, why can't you? Right? So just knowing that other people might approach the same situation differently, I think, is empowering. There's a great article on evidencebasedbirth.com about the research behind inducing just for gestational diabetes. And just like Jeanette said, if we have 2 people, one of them is 40, has hypertension, the baby's large for gestational age by ultrasound, and has uncontrolled diabetes, that's going to be a lot different than somebody who is, otherwise healthy and it's controlling their diabetes with diet and having normal blood sugars every time for the rest of their pregnancy. Like, I don't think both of those people should be given the same recommendation. And anybody who's critically thinking about the guidelines would agree with me.
Mm-hmm. Yeah, awesome. So let's change the move away from medicalized conversation to something a little more gentle. It may be considered woo-woo in some groups. So how does posting birth affirmations around your house help you during labor?
All right, doula Jeanette, you just went to a birth here.
I
Jump back into your doula shoes. So what do you think?
I think, I used to think this was a little bit over the edge of woo woo for my taste, but honestly, sometimes just saying stuff in your own head, nobody has to hear it, you don't have to be embarrassed about it. That's one thing. Or you could have little notes that are hidden on your computer or in a place that you only look that just say you are strong. You could have them on your mirror and you could write them on your mirror. You could have post-its everywhere in your car or little you could change your phone so that every time it rings to say you have a text it could be like you're so awesome. Like I think there's a lot of power in suggestion and there's books written about that. And the more you see something and repeat it, the more you actually might believe it. And oftentimes the things that we as childbirth educators might encourage someone to write down or have as an affirmation are very, very simple things that are true, but they're not things
Hmm.
that people constantly tell us. Like, you're
Right, like our
strong,
body
you
can
can
do
do
this.
this, your body was made for this, your baby knows the way out, you can do this, your uterus has all the strength it needs, like all these different things, and you can get a lot out of it. And I think a lot of people do. Like every morning, I'm drying my hair and I see these post-its on my mirror, and I just keep looking at them, looking at them. And then you take those same post-its and you have them around the room where you're laboring. That can be really powerful for some people. And then there's people who don't want that at all, and that's fine. But I think it can really, really help a lot more people than they think. So it's worth a
Yes,
try.
I agree. The power of positivity has been well documented. Um, and also, uh, actually, I just had a conversation about this the other day with a client who took my class. I said, I want everybody to understand that if you grew up in the United States, if you were a person with a uterus who grew up in the United States, you have been told since a very young age that birth is scary and
Mm-hmm.
terrible and painful. And that is the culture that you grew up in. You did not grow up generally, unless your parents, had home births, right? If you just a mainstream, kid in America, you grew up thinking that birth was going to be horrible. The video they show in ninth grade, that standard miracle of birth video. I've
Mm-hmm.
had many
Mm-hmm.
childbirth ed couples over the past 10 years that I've been teaching say, I don't want to watch any of the videos in class today because
Yeah.
the one I saw in high school was so terrible. And I've had to like really explain like that video is not a good depiction of labor
That
and birth.
video was literally meant to try to prevent you from having sex.
Yes, that's exactly right. I mean, that was part of sex ed in
Mm.
public schools was, showing a horrific view of childbirth. And so, knowing that, it's worth it to try to start counteracting that. One great book is Birthing from Within by Pam England.
Mm-hmm.
Um, Preparing for labor is as much about physical preparation and being healthy diet and prenatal appointments as it is about mentally preparing. And so if putting some little positive birth affirmations around, in your phone, on your your touch screen, when you turn on your iPad or post it on the bathroom mirror, I think does make a difference. I had a friend who listened to positive birth affirmations in her car whenever she drive to and
Mm-hmm.
from work. I know that many clients that I've taken care of in labor as a nurse, if they have things like birth affirmations, that helps me as the nurse taking care of them, or the doula, or the support person, or the midwife, know what types of birth affirmations you want to hear. Right? Because I remember, I don't know if you remember, Jeanette, but when I hired you to be my doula for my first, I said something to the effect of, I'm super supportive of all of that kind of birthy goddess stuff, but don't talk about the goddess to me in labor. And you're like, don't worry. I was just, I knew that
That's not
it
where
wouldn't
my
work
brain
for
goes
me.
either. That's not
Yeah.
my.
Like if you were going to tell me that, like, my yoni was connected to every other
You're
yoni and the birth
opening like a
goddess.
lotus flower. Like, and that
Exactly.
works for some people, and that's
It does.
awesome. But
It
that's
was
not where
not going to
my
work for me.
brain and my mouth goes. Like those words don't come out. So, yeah,
Yeah. Yeah.
you just
And
stay
so if
true to what resonates with you.
absolutely. And some
Like you and
people
I
like
both know our
that.
friend Mary Baker,
Yes. Oh, I love
midwife.
Mary Baker.
Oh
Yes.
my goodness, when that woman speaks to somebody in labor, like the words that come out of her mouth are amazing. And I'm like, how'd you come up with that? And for a long time, I was really jealous of that. And I was like, oh, as a doula, like I want to be able to say that. And then I was like, wait a second, that's her style. That
Yeah.
comes from her within. And it sounds really lovely coming from her because it's authentically her. And that's
Hmm.
not the stuff that I would say, you
Right.
know? And it's just, and every partner's going to have their own way of speaking to somebody, and some partners need to be quiet because that's the best thing they can do, because they can't come up with something, and if you try to force it, it's not going to work. But the
Right.
same thing, like, you can't, like, go on the internet and find some affirmations that you don't really resonate with and print them out and put them up on your wall if they don't resonate with you. So
Right.
finding, like, there are people who might really need swear words in their affirmations.
Yeah. Like get this
You can
baby
effing
the
do
fuck
it,
out or
like,
something.
right, like, like, if that, you're like, yeah, like, if that works for you, then that's an affirmation. It doesn't have to be um, counter to what you normally would feel comfortable with.
Absolutely.
But yes,
Absolutely. So
they
find
can
something
work.
that works for you.
Awesome. All right, another question was, what are some practical things to do around the house before baby comes, besides packing a hospital bag and getting the baby sleep area ready?
Well, number one thing is to take my new baby and postpartum ready class. Just gonna throw a little plug in there.
Well, all the birth classes that we offer, but definitely that class, because it prepares you for having a baby in your house and postpartum. It's not just about how to care for the baby. There's a little bit of that because that's important. But yeah,
No,
you got to be
absolutely.
ready.
I think one of the things I hear time and time again from people that have taken my classes or that I've taken care of in labor, they say, I wish I had spent as much or even just as much, if not more time preparing for postpartum than I did preparing for labor and birth. Because labor and birth is a very, very special thing. I have a bumper sticker on my minivan that says peace on earth begins at birth. And I truly
Hmm.
believe that. But it is only one day out of your entire parenting experience. And how you're going to survive living with a newborn is very, very important. So, all right, Jeanette, what do you think? Besides taking my postpartum ready class, what can they do?
So I think practicing labor positions around your house is one way to get ready for the baby.
Mm-hmm.
But then moving on to probably what she was more intending for with this question was childproofing. Get that stuff done now.
Mm-hmm.
You are not, like, people think like, oh, I'm gonna have 6 months until they crawl, and then I'm not gonna worry about it. Yeah, but you're gonna have a baby that whole time. You're gonna be busier than you can even fathom. And so getting childproofing stuff done and ordered and figuring out what companies, and we have a whole other podcast on that, and you can message us for questions on like companies that people recommend, and some of them are in the podcast notes. But it's just so important. Just get that stuff done. Get your stuff anchored, your dressers, your TVs, your shelving units. Figure out what things need to have corners put on them. Figure out the gates that are installed into the walls.
Yes.
Spring gates sometimes can be okay, but some kids can still be eventually heavy enough to push them over or figure them out. So I think spending a lot of time planning for that is going to be so much nicer for you once you have the baby.
Yeah, that was
That's one
episode
thing.
21, childproofing with
There you go.
Kimberly Amato.
Yeah.
Has a lot of great information, so definitely
Hmm.
check that out. Um, I would also say, create a postpartum plan. So, if you are the pregnant person, I want you to write down all of the chores and household responsibilities that
Mm.
you do to as part of your family unit, and then with your partner, draw a line next to each one and put somebody else's name, because it can't be you for the first 2 to 3 weeks. So whether that's walking the dog, going grocery shopping, doing the laundry, paying the bills, whatever it is, you are going to be focused on taking care of your own personal hygiene needs, sleeping when the baby sleeps, and feeding the baby. And that is a full-time job because you're recovering from either major abdominal surgery or pushing a human baby out of your body. So having a postpartum plan is super important. Um, and there's lots of templates online. You could even look up like how to make a postpartum plan. Considering, with, uh, you know, a lot of people don't have maybe family around that can help with those types of things. You might want to even consider looking into a postpartum doula, which a lot of people don't even know what a postpartum doula is. And we
Mm.
actually did a great episode. Episode 7 was with a postpartum doula, Heather, and she talked about what postpartum doulas can do, but also how to prepare for postpartum. So that's another great episode to listen to. But yeah, check out babiesincommon.com/resources for some of the postpartum doulas that Jenna and I know or have worked with.
Mm.
But yeah, finding somebody, and even if it's Instacart and you have to, create a standard order that your partner can just like add to, right? Whenever you
Right.
need groceries
Right.
delivered.
Right.
But it
Or a
can't be
list
you.
of brands and sizes of things that you normally like, so you can give it to a relative when they say, I want to come see the baby.
Hmm.
And you go, okay, you have to pick up these things first. Not just like, can you pick up milk and eggs? Because maybe it's not the kind you want, you know?
definitely. Anything else? Any practical things to do around the house?
I just had one in my head and it just flew away. It was super important too.
I have
Goodness.
something not to do.
Yeah. Okay,
I
what
have
not to
a
do?
practical thing not to do is do not unpack and wash and take the tags off of all of the baby clothes you get from the baby shower,
Don't.
because I really need to take a picture of my niece. I babysit her on Wednesdays. My daughter and my niece are 1 month apart. They were both 6 pounds at birth. Okay. My niece is in size 18 months to 24-month clothes. My daughter is in 12-month clothes. They are totally opposite sizes. Like, and so, you do not know, even if they bought the right size quote for the season that they think it's going to be, you don't know how big or small your baby's going to be. You don't know when they're going to grow into different clothes as far as what season, but you also don't know what's going to work for your kid, right? Like, for example, with my boys, I always used onesies. It just worked out best. But with my daughter, it's easier for me to just have her in a t-shirt and not have snaps at the crotch. So and you just don't know. And so, maybe the newborn size or the 3-month size, but everything else, like, you might think, oh, I'm going to get this stuff ready because then I don't want to have to worry about it postpartum. How about this? How about save the washing of the clothes?
Yes.
And
you do not need that special
childproof instead.
detergent. You don't need special detergent for your baby clothes. You should all be using non-toxic detergent in the first place.
Yes.
Therefore, you wouldn't need special detergent for your baby either.
And plus the draft, which everybody
Oh, no,
uses,
don't
is
do it.
actually
It's not-
full of toxic
Yeah,
chemicals.
yeah, exactly.
So there's that
Yeah.
side. No.
I remember the other thing I was going to say is cook ahead of time. Like, if you
Yes.
have certain meals that you know you like and they can freeze well, package them as, like, cut things up and package them and put them in the freezer. Like, figure out what things are ahead of time. Maybe you make entire meals that you can put in the freezer, or maybe you gather some recipes and you give them to people in your life who know how to cook, and you say, this is one of my favorite things. I would love for you to make this for me at some point. And people are always saying, like, well, I don't know who would do that for me. You come up with a list of 5 to 10 people that live relatively near you, like within an hour. Of those people, it should be, if you're going to do this kind of stuff for them, if they had a surgery or they were ill or they had just had a baby and they needed something, would you be like, of course I would cook them something? Guess what? They're going to want to cook something for you too. So
Yeah.
it's you don't have to have family nearby. And plus, we all know that not everybody has family that's going to do that kind of thing for us.
You can even ask your best friend or a sibling to set up a meal train for you, so
Right.
that you're not the one doing it. And then it's like your sister who says, hey, everybody on Facebook, my sister's having a baby. Does anybody want to sign up for a meal train?
More
That
people
would be
will
a
do it than you
wonderful
think.
gift. Yeah,
Yeah.
more people will definitely do than you think. Even if you can't cook, you could always, people are coming over to visit, you can tell them, can you just bring me a couple salads from Panera, something. But
Yeah.
a lot of
Cut
the
up a bunch
patients
of
that I've taken
vegetables.
care of, sure, yeah, they will, instead of just like taking time to make extra meals to freeze, they'll just, for like at least a couple times a week in the last few weeks of their pregnancy or whatever, they'll like double a meal that they're already going to eat and then put half of it in the freezer. And I've had a lot of other friends do things like make Instapot meals, but they just put all the ingredients in a bag and then
Yeah.
freeze that, so they can just
Nice.
dump and press start. So
Nice.
anything like
Nice.
that, I think that's on the great tip.
Yeah, yeah. All right. And I guess one other thing I would say for that is go ahead and put your mattress on the floor and get rid of your bed. And that sounds so wacky to most people, but it will come in so much more handy with life.
Yep. And if you're interested as to why, I definitely recommend checking out the Safe Co-Sleeping 7 for Dr. James McKenna. Google that, because you're like, why would I want a floor bed? Because even if you don't intend to bed share, if you are especially a breastfeeding parent, you will probably at some point need to get some sleep
Yes.
in bed share.
Yeah.
All right. Since you're the doula, Jeanette, I'm going to ask you the next question. My husband or my partner will be with me in labor. So why should we hire a doula?
So, doulas, first of all, are people who are trained and experienced in providing informational, emotional, and physical support for people in labor, as well as doing some prenatally and as well some postpartum. And we are people who we've learned some tricks, and we know what's normal, and we know how to help you communicate with your care providers. We don't speak for you, but we can say, why don't you ask them about this, or why don't you try this? And we can suggest things for your partner, whoever that birth partner is. Why don't you try this? Or, okay, I can do this while you go take a break. Or do you need to go to the restroom, or you want to get a sandwich? I can take care of that. who does not want a four-handed massage is the question I always ask.
That
Like,
is true.
most people in labor want touch of some level, whether it's massage or just pressure. They want that, and it's also like who's going to be massaging you while you're also getting a drink from someone else, or while they're going and getting something for you that you might need, like a towel. And so they're people. Doulas are people that are going to look at every single thing that you need. Think about it all in advance. I know there was one time I went to a birth at a hospital, big teaching hospital, and the bathroom of the room that this person was laboring in was not clean. And like there was stuff on the walls, and the sink wasn't that clean, the toilet wasn't that clean, and I cleaned it, and I never told them because I don't need to, but I wanted it to be nicer for her so that when she went in there, she didn't notice that the bathroom was dirty. And that's like this
Oh,
little thing that like the doula, I mean, the person's never going to know, but maybe the doula would take care of that, or options that the doula can think of. And your partner is the one that's good at supporting you in, if they're your romantic partner, life partner, like they love you and they know how to support you in that way. If it's your mother, your sister, or maybe it's you've got other people there too, why not? I remember one birth I was at, there were 10 of us there. It was awesome in a hospital. And
really?
yeah, yeah, it was so fun.
And
So
everybody
fun.
was actually helping, not just being a spectator, because that's
No,
my
no.
big thing.
Well, no. It was actually a mom who wanted an epidural.
Okay.
So it wasn't like, the stereotypical like earthy crunchy wanted a home birth in a hospital kind of situation. She
Hmm.
wanted an epidural, but she wanted a bunch of people there. And so during her labor, it was me and her partner and her best friend. And then as it got closer to pushing, then everybody else came in. And then there was also like one nurse and one doctor. And so it was probably 8 of us that were guests, right? Maybe 7. Maybe it was just 7, but there was a lot of us ultimately. And her father was behind a curtain listening, which was such a blessing for him because he had never seen any of his children be born because he was of a generation where that was not happening,
Oh, yeah, right.
which was really sweet. So it's sort of, but anyway, my point is that all those people, they're there to support you in an emotional way, but they're not trained in all the ins and outs. And your partner, oftentimes it's their first birth, or maybe it's their second birth, or maybe it's their third birth, but that doesn't give them the extensive experience that a doula would usually have. Obviously, there's beginner doulas who are just starting out, but they've at least had training that your partner hasn't had.
Mhm.
So it's the other piece of it is that the research all around the world, since they started researching doulas, and first of all, since the dawn of time, people, particularly women back in the old days, right? Women giving birth were surrounded by women. That is just the way it's been done since the dawn of time. And so now that we're doing hospital birth, it's very much like, no, you get one person in labor and one support person.
Hmm.
And that's just not how humans were designed to exist in labor and give birth. It's very much a community based event. And so doulas are filling that role for a lot of people. And the research globally in multiple countries in the last 30 years has proven time and time again that having a doula lowers C-section rates, lowers length of labor, lowers the need for epidurals, lowers postpartum depression, lowers C-section rates. Did I say that already? I might have. And
Hmm.
increases the satisfaction of when you talk to people who've had a doula, they're more likely to say they were extremely satisfied with their birth. There's just so many reasons. So one of the most famous quotes is that having a doula, sorry, not having a doula is like going to court without a lawyer. You could do it,
Oh,
but why would you want to?
oh, that's a good one. I've always heard going into labor without a doula is like hiking Mount Everest without a guide.
Mm.
You could do it, but you wouldn't want to. So I like the
Mm-hmm.
lawyer one too.
Mm-hmm.
Doulas caretake the laboring person and help your partner be the best, most supportive
Mm.
partner they can be, hands down. And even as a labor and delivery nurse, delivering at a hospital with I could hand pick the nurses and midwives that were taking care of me, the room I got that I wanted with my partner and my mother who had had 4 vaginal deliveries herself, who was somebody who was very supportive and I knew would be hands-on with me in the way I needed. I still had a doula at my delivery, Jeanette, and I had a doula for my second and my third births as well. So definitely something to look into. It would not be something you regret. I can put money on that.
Yeah, and I had a home birth with my second one and had a doula. And then I was just the doula at a home birth, and I've been a doula at a home birth before. So just because you're
Awesome.
having a home birth with other people that might be there to support you, there's a specific role,
Yes,
things that we
definitely.
do. So it's
So one
super
of the ways that,
important.
yes, it is. And one of the ways that doulas can help is by helping you get into position that optimize the way the baby's positioned for birth. So Jeanette, since you are a spinning baby certified parent instructor, can you talk a little bit about what's
Mm.
the optimal way for a baby to be positioned for birth? That was one of the questions a listener had.
Mm. So there's a whole class on this, but the optimal position for birth is where your baby is looking to your right side or possibly looking at your back. But the goal is to have their spine lined up throughout labor, either on your left side or in the front of your belly. And that enables their head to tuck their chin to their chest and then enables the part of their head that's coming through the pelvis to be the smallest. And those of you who are just listening can't see that Melissa is demonstrating with a doll on a pelvis.
I am
Um,
demonstrating with a doll on a pelvis. It's
and
like
there's,
doing limbo by cheating. You know, instead of doing limbo the way you're supposed to go with your knees first, it's by ducking your head under the
oh,
bar.
that's a great, I love
So
that. That's right. It's, yeah, I love that analogy. My gosh, I just got another exercise in class. I like that. Um, yeah,
perfect.
so it's thinking about like the way that you're positioning your body during pregnancy too greatly affects how your uterus sits, which is a muscle. It sits in your body and it can get twisted and prevent your baby from having room to get into a better position. So we want to balance where the uterine muscle is, balance the ligaments that are attached to the bones of the pelvis and the legs as well, and finding enough space so that the baby has room to move when it's ready, but also positioning your body in ways that support that movement, like leaning forward. So gravity's helping that baby's spine turn towards the front of your belly, towards your belly button, and or at least on your left side so that they're facing your right side. And so that's really helpful to optimizing the process of labor and giving birth to the baby. And of course the baby's going to move during labor as well, which is why it's best to not be on your back or just laying in bed the whole time of labor either, despite the fact that most people give birth in hospitals and you walk in and you see a big bed and you go, oh, I guess I'm supposed to go there. No, stay out of bed as much as you can.
Absolutely. Well, another
Yeah.
question a listener had was, if I have an epidural, do I have to labor and deliver on my back? So, what would you say for that, Jeanette? Because
I've
that,
been talking already a lot. You answer this one.
the answer is no. Don't. There's something that Penny Simkin, who's a very famous uh, in the world of birth, she talks about the epidural rollover in many of her books.
Rotisserie.
Yeah, the
Yeah, yeah.
rotisserie. And so basically it's, you can sit in the bed with an epidural, and that's like the general, like, head of the bed's at a 45-degree angle, the legs are straight, kind of like how you would recline on a chaise lounge, right?
Mm,
But that is a really terrible position for the baby to be getting into the best position for birth, and also for you to be giving the baby the most room for getting into the
mm,
best position for birth. Because when you're in that type of position, even if, again, you're not flat on your back, you're just kind of reclined like a chaise lounge, your tailbone and your sacrum do not have the space to flex backwards. And so you're really collapsing your pelvis and making it smaller by, up to 30%.
you were just
That's not
demonstrating
good.
that with a pelvis. So, for
I
those of you
was.
just listening to the podcast, you might want to go to our website and watch this one.
Yeah. And so, if at all possible, being off your back is going to be helpful. So if you have a less than ambitious labor nurse, she might only be comfortable with right side or left side, but that's good. All right. That's better than on your
Hmm.
back. So right side and left side, even if you just flip from right side to left side every 30 minutes, that's awesome. If you have a more ambitious, a nurse that's gone through extra training, like I've taken the spinning babies class a couple times as a provider, she's going to have more ideas. If you hire a doula, she's going to have more ideas as well. And even if the nurse isn't comfortable with, getting you into different positions, the doula can facilitate that. I have gotten people into hands and knees positions
Hmm.
by dropping the foot of the bed and helping a woman get into like a supported hands and knees. I've brought the ball up onto the bed and had a woman kneel over the ball. Of course, you cannot
Yep.
sit on the ball on the bed when you have an
No.
epidural. I've done right side just with pillow between the legs, right side with a peanut ball between the legs, left side, same idea. I've done even kneeling lunges with people with epidurals. And now, depending on how dense your epidural is, and how physically strong you are, you might be able to be in these positions uh, easier or not. Some might be easier than others. And even if it's only 5 minutes and you did a couple
Mm-hmm.
lunges on one side, then a couple lunges on the other, I mean, that's going to help stretch out those ligaments
Huge.
and open up that pelvis. So,
Or
no, you
even giving
absolutely.
birth, you could be I've had people up in squats
Oh,
using the squat bar.
absolutely. Yep, with a squat bar. Yeah, you don't even have to get your butt off the bed. You can just hold on
Mm-hmm.
to the squat bar and kind of position yourself like you're sitting on a toilet. And so a great childbirth class is going to help you learn these positions like Jeanette's Move and Get Comfy for Labor. Hiring a doula can help facilitate that as well. Um, Choosing a hospital um, birth that has a low cesarean section rate, so a
Mm.
higher vaginal delivery rate, probably means, it's not a guarantee, but that the people there value vaginal delivery and maybe are more trained in helping you have a vaginal delivery, um, or considering an out of hospital birth like a birth center birth or a home birth where the participants, the attendants, are definitely more,
Mm-hmm.
but of course you can't have an epidural there. So if you're
Right.
looking for an epidural, bring your money talks. So bring your money where that is public information. C-section rates in hospitals across our country.
It's usually a few years old, unfortunately. So if you know a labor and delivery nurse at some hospitals, you can usually, or doulas usually know kind of what the current pulse is.
Yeah, that's true.
Yeah.
That's true. So
I
yeah,
think
you
the other
don't
thing
have to.
to think about with epidurals wanting to change your position a lot is that asking for a nurse who loves natural childbirth is like my expression that I like to teach people, encourage people to say when they're meeting their nurse or when they're calling to say I'm coming to the hospital, that you want the nurse who loves natural childbirth. Because even if you want an epidural, she's the nurse, usually she, that has gone to extra training and has learned how to support people, whether they want a natural childbirth or just to be more flexible and reduce side effects and risks with epidurals. They tend to learn those things. And all the nurses, right? Like you've been a nurse, like you know who the other nurses are that are into that stuff like you are.
Totally. Yes. And they are happy to give those patients to me.
Yeah.
They're always like,
They're
another
like,
one for Dubois. No.
yeah, yeah, absolutely, absolutely.
I remember once actually, I was at work at a hospital, and the charge nurse came to me and she said, "We got two patients coming in. Do you want the induction or the one with the birth plan?" And she rolled her eyes, and I looked at her and I said, "You seriously are going to ask her that question right now?" And she goes, "I knew it, birth plan." So like, that to me is awesome. An informed person, even if that birth plan said, "I want an epidural," I don't care. It doesn't have to say that you want an unmedicated birth,
Yeah,
but to me, someone having a birth plan is a good thing, not a bad thing. It should be a good
yeah,
thing.
yeah,
So
absolutely. So,
speaking about plans for birth.
along the lines of a doula, so recently because of the pandemic, somebody says, I have a doula, but my hospital is saying doulas still aren't allowed due to COVID. Is there another option?
Hmm.
What's the option, Melissa?
So I actually took a training on this with Diana Snyder, who is a lawyer and a
Mm-hmm.
doula. She
Mm-hmm.
just unfortunately moved to
Mm.
Wisconsin, but she is wonderfully knowledgeable, and she talked all about the legalese around patients' rights during the time of COVID. And unfortunately, having visitors at the hospital is not a right that you have as a patient. They are allowed to restrict visitors. That being said, your partner, your one support person, whoever that person may be, is not considered a visitor. So that's a completely separate thing. World Health Organization says that making people labor all alone is
Mm.
against their human rights and cruel. And so your partner or your support person of choice is not considered a visitor, but anybody else, like a doula, like your mom or your sister or your friend, would be considered a quote visitor if they were in addition to your partner. And so you can't like fight that. You can't say like it's my right to have a doula, because it's the
Mm.
hospital's right to restrict visitors as they see fit. That being said, many hospitals are turning this over. We're broadcasting from Massachusetts, and there was public health statement that came out quite a few months ago now, saying that hospitals should be considering lifting this visitor ban to allow for a second support person in labor. And so if your hospital has not done that, there are many hospitals in Massachusetts that have. And if you're in a different state, finding out one that does. And maybe I actually just recently had a client who wanted she was a single mom by choice. She wanted her mom there, but she also wanted a doula. Her mom was older. And so she wanted to have the doula there for physical support and hands-on stuff. And the hospital that she was planning on delivering at had not overturned that rule. And so we kind of talked about it a little bit. And I said, well, what's going to make you feel the most comfortable when you give birth? And she said, having my mom and the doula there. I said, then you got to move, like that. If that's what you're saying is going to make you feel the most comfortable, that's what we need to facilitate. And so she ended up having her baby at a different hospital. She transferred care in the 3rd trimester, and she emailed me and was thrilled with her decision to transfer.
I think the other thing to think about is that if a hospital is not allowing a doula or a second support person, that is very likely a way for that hospital to knowingly allow themselves to pressure their patients into doing more things, because they know that
Absolutely.
doulas are effective. They know that support is effective. And why would you want to go to them, even if your OB or your midwife is so nice and you like them so much? On a systemic level, that hospital doesn't want you to get what you want.
I'm going to talk some
And
real talk here as a labor and
that's
delivery nurse.
maddening.
It is some real talk that I think a lot of people don't realize is that, people say like, well, doulas are controversial. So doulas are not controversial. The
No.
only people that have a problem with doulas, the only people that have a problem with birth plans, the only people that have a problem with unmedicated birth are people that want to push interventions on you, period, that want to control your choices. So if there's a hospital that is trying to control your choices, telling you that you can and cannot do things, that is that's not in your best interest. It's they're protecting their best interest. Hospitals or places of birth, out of birth centers or providers that are supportive of evidence-based care, that are supportive of your choice, your ability to make choices about your care, do not have a problem with doulas. They do not have a problem with birth plans, and they don't have a problem with unmedicated birth, period. The other thing I'd like to say too is, let's say you are somewhere that there's only one hospital, you want an epidural or whatnot, or you have a high risk situation where you have to give birth in a hospital. There's only one. Maybe I actually have had taken care of a number of people who are vets and they have to deliver at a certain military hospital. There are doulas that you can still hire, and you can labor at home for as long as possible. There's even doulas that have birth tubs that you can rent, and so you can rent a birth tub kit from them, and you can labor at home in the water for as long as possible, and then just head to the hospital at the last possible moment. If the doula can't make it there to support you in person, she can continue her support, or he can continue his support virtually through FaceTime or Zoom or Google Meet up. So
Yeah, and that's like relatively new, that since this pandemic, people got creative. I'm sure there were a few people here and there that did that before, but many doulas are now experienced in doing labor support via FaceTime or Zoom or whatever. And it's still really, really valuable. Just put the phone on the shelf and occasionally pick it up and be like, now what do we do? Or like, I'm not currently seeking doula clients, but like if I was like on the shelf, I'd be like, yo, Jack, like, hey, why don't you push harder? Go on our left side. You've been here for half an hour now. Why don't we switch positions? Give her a drink, Like being able to have a coach who's like watching what's going on, or you could occasionally pick up the phone and be like, okay, so they just said this, you heard them, right? So what do you think of that? And being able to give that perspective of like, well, why don't you ask about this? Or why don't you ask about that? Yeah,
or they can
valuable.
decode the medical codes for you, right? Like P.S. when the nurse just said the doctor was going to come in and get things going, they meant break your water, so heads up if that's not what you want.
Yeah,
There's a lot of code in
yeah.
in medical care.
And the other thing I want to add too about doulas is that we're not always there to try to prevent things from happening to you. Sometimes I remember being my role as like the mom would look at me like, really? Do I have to have this done? And I'd be like, mm-hmm. Like it really was the thing that started to make sense. Like that was a medical intervention
Yes.
that in that moment felt like, given my experience in education, was like, yeah, this totally makes sense right now, given what you have going on. But she
Right.
was stressed and she's like, I don't know. What do I do? And to be able to look at your doula who knows that that's not what you originally wanted, but now she's saying, yeah, that's what we got to do, makes it so much easier to accept, instead of like, I don't know how to make this decision. So sometimes medical interventions are necessary and warranted, and
Absolutely.
it's great to have that other person there who can make that clear to you as well.
I 100% agree.
Yeah. Alrighty. My doctor seems so rushed during prenatal appointments, and in this time of COVID, they won't even let my husband be there, and not even via FaceTime. I'm thinking about moving to another hospital. How do I do that? Melissa, how do you do
We
that?
actually did a whole episode on this actually as well with
That's right. How
Emily
to
Garcia
fire your
Sega.
care provider.
Um, yeah, and what we talked about was how it's so not as intimidating as people think, right?
Mm,
So what you would do is you would simply decide on, if you wanted to switch your care provider, find another provider that you wanted to get your care from, and then you call the provider that you're currently seeing, or usually you can do this even with an online form. You sign a release form to have your records released to the new provider, or you even, when you see your new provider, you sign the form there and they fax it over to your old provider and they have them fax your records over, and that's that. You don't even have to have a confrontation
yeah.
or
You don't even
any
have
type
to do
of.
the breakup in person. It's like texting a breakup,
Exactly.
but
Yeah,
the
episode
care provider's
25
like,
we
meh.
talked about that.
Yeah. Yeah, the one you're breaking up with probably was feeling like they either didn't even know who you were because they unfortunately have to see so many people. So they might care, they might be a nice person, but they're just overwhelmed with the number of people they're required to see in that particular practice. Or you're the type of patient that wasn't the right fit for them anyway, so they're probably excited for you that you found someone that fits better with what you want. So I think it's not always a negative thing whatsoever. Most of the time, it's not at all. Very, very simple. Yeah.
Yeah, not it's something I strongly encourage people to consider, is finding a provider and a place of birth that already aligns with their hopes and wishes for their birth experience,
I just
and
thought of
give them the
something
care that they
fun.
want.
There should be a service where somebody says, I want the following 5 things are really important to me, and here's where I live. Where should I give birth? And then there's
Yeah, it's
knowledgeable
called
people.
hiring a doula.
Yeah, there's that, right? There's knowledgeable people that are like, oh, I could tell
They will
you
tell
where you're
you.
going to get that. Exactly. But people don't believe that. And I feel like sometimes as a child birth educator,
No.
I'm like trying to encourage people to switch and try over here and try over here. And people are often like, but. And I'm like, stop it. I know what I'm talking about. You don't know. And I'm like, I'm just trying to help you have the best experience
Yes.
here. You're
Yeah.
telling me what you want. I'm telling you where I know you're more likely to get it. And if you stay where you are, you're less likely to get it.
Yep.
That's all I'm saying. Trust who knows. And yeah, I wish they would listen. And sometimes they do. And they're very happy with that. So it's
Yep.
good.
Yes.
All right, last couple questions.
Absolutely.
How can I articulate my preferences, i.e., a birth plan, in the hospital? Melissa, what would you say about
So,
before you get to the hospital? What do you do with the
so,
birth
again, as we've said 1,000 times,
plan?
choosing a place and a provider that already follow what you want is going to be far easier than fighting for what you want.
And
But
the
that being
research shows
said,
that that's the most important thing. The number one thing that influences whether or not you will have a cesarean, for example, is the hospital you choose. And the number two thing that determines whether you'll have a cesarean is the provider that you choose.
yes,
It is not how your labor goes
it's
that
not
will
your risk
determine that.
factors, it's not your age,
It's
it's
first
not
the hospital,
anything.
second the care provider. Super
Yes.
important.
Big study that came out of California talking about that.
Hmm.
So how do you articulate? So let's say you don't have that choice and it is what it is. I do recommend that you bring your birth plan to one of your prenatal appointments and talk to it with your provider. But I do recommend that you ask if there's any way you could have a 30-minute appointment.
Hmm.
Although
Like maybe
ideally,
around like 28 or 29 or 30 or 32.
yes,
Like not at 36 or 37, which is when your care
absolutely.
provider's ready to talk about it. Way before that.
Yes, way before that, because and then have them initial or on your actual plan and sign it, or explain to you if there's something that can't be done, why, so that you at least know going into it, you're not giving over this birth plan and half the things on it that are definitely not going to happen. You can prepare for that ahead of time. I've had people bring birth plans to the hospital that say things like, I want to labor in water. And I'm like, we don't have a tub here. And they didn't even know. So it's like, that would have been nice. Maybe they would have stayed home longer. Maybe they would have rented a birth tub. Maybe, so something simple as that. But
I've had people tell me multiple times. I brought my birth plan to talk to my doctor, and they said, "Well, I really prefer my patients to have epidurals."
mhm,
And I'm like, "What a gift that they told you that." So if that's not
yes,
what you want, you leave. They told you explicitly what they want you to do. If that's not what you want to do, then go somewhere else.
Yes. Let's say you can't. Let's say they can't.
Mm.
So you have to bring it to the, and then you want to bring it with you to labor and delivery, and give it to the nurse and ask for it to be, a copy to be made and put in the front of your chart. Ideally that nurse would take it and read it over in the room with you and talk about it. That's how I
Or it was
practice. But
already in your chart because your doctor or midwife put it in your chart. I showed up
yep.
with my first labor for my first baby, and I remember asking, and I showed up late in labor. I was already 7 centimeters when I got there, and I remember saying to the nurse, I said, do you need my birth plan? And she said, nope, it was already in your chart. I already read it. And my anxiety level went down so fast. I was like, shoo, she already saw it. Cool, we don't even have to have that conversation. She's like, nope, looks good. I already saw it. I'm like, how thorough is she that she already looked at it before I even walked in the room? So
That's
good.
awesome. I think that's happening less and less as we have
Mm,
electronic medical records,
yeah.
because back in the day, all the offices used to send over your printed prenatal record
Okay.
with, at 24 weeks and then
So they're
again
not
at 36
scanning a
weeks.
birth plan and putting it in the EHR?
It depends if you would have to ask.
Huh.
So, giving a birth plan to your doctor, and asking them to put it in your chart, you would actually want to give it to the secretary and ask her to
Mm.
scan it into your
Oh,
chart,
good.
because
Okay.
the provider is going to not
Yeah.
think about
Okay.
that. They're
Good
not
point.
they're not the ones that scan things into
Yeah, yeah.
medical records. So secretaries and unit receptionists do a lot to keep those offices running. I have a high respect for them. But then so if it's not already in the chart, then bring another copy with you, asking for the nurse that cares very deeply about the type of birth that you want, and then also understanding that there's going to be some concessions that you might have to make. So and then figuring out what's very important to you. So that's just the reality. And if you don't like me saying that, then consider changing your place of birth. So if you're saying I should be able to get everything I want
Mm.
because that's my right, I agree with you. But the reality in America is that it's very hard to change the culture with one birth, right? It's impossible. It's like trying to push a glacier. So if, you are asking for intermittent auscultation and the nurses there have never done that.
Meaning they're listening to the baby's heart rate occasionally,
Exactly,
as
which is
is the
evidence-based
evidence.
care. Yep. Listening to the baby's heart rate intermittently throughout your labor instead of continuous fetal monitoring. If the nurses that work at that hospital have never done that, then it is very unlikely that that is going to happen, nearly impossible, because they are not comfortable. And so you're going to get into a fight about it. So if that's super important to you, then you have to find a place where that's not the standard of care. If it's not that important to you, but maybe skin to skin right after birth is, and then fighting for that, right? But otherwise, it's just know that it's hard to fight and also be in labor. So ideally you would find some place that already does what you want to do.
Hmm.
Any other tips you have, Jeanette, about the birth plan?
I think also the birth plan should start with good childbirth education, or at least doing some good research on the internet, because maybe you're putting your birth plan together before you've taken all your classes. But it's really about talking to your partner, like whoever's going to be
Yes.
at that birth with you. What do you need to communicate with them, especially if it's if it's the baby's other parent? Then you're really trying to figure out, like, where do they stand, because sometimes you may, as the birthing parent, be like, I want to go all natural, and your partner's like, I am so afraid to see you in pain, I really want you to have the epidural.
Mm-hmm.
That's a hard conversation to have. Or it could be the opposite. I've actually seen that happen, where the parent who's going to give birth is like, I totally want an epidural, and her partner is like, I don't want you to have drugs with the baby.
Yeah,
And you're like,
I've seen both too.
let's gently talk about how this is the birthing parent's choice here, not
Yeah.
not the other person.
Ideally, that conversation is
But
not happening at 6 centimeters.
no, yeah, you need to have this conversation. And if coming, I mean, there's different cool things to do in labor to kind of determine that conversation in that moment too. But you definitely want to talk about, what do we want, and even some of the simple things like right after the baby comes out, who's doing what. Like, I
Mm-hmm.
know, I always remember one couple where it was their second baby, and dad really wanted to help catch the baby. And he asked the doctor, can I do that? And the doctor said, absolutely not. Absolutely not. And he expressed to me that he was very sad about that. And I said, well, there's other care providers that would be totally open to that. I've seen it happen at your hospital. And they're like, no, 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 we're going to stay with this person. And wouldn't you know it, how the cosmos works, a different doctor was at their birth than their own OB. And that new OB, well, fresh to them, this other
Mm-hmm.
OB, as the baby's about to come out, had no idea this conversation had happened because the first OB said no. So it's not even in the plan anywhere because the dad was like, well,
Mm-hmm.
forget that. I can't even write it down because the doctor said no. Out of nowhere, the OB is about to catch the baby and he goes, hey, do you want to help catch your own baby? And the guy was like, oh, yes, I would love to do that.
Oh,
And so he got to do it and it was amazing. So, it's like these little things, but if his partner didn't know he wanted to do that, she might have been like, absolutely not. You're not going down there. You're not going to help catch the baby. So you want to have these little conversations with each other first. Really important.
absolutely. Absolutely.
And then that's another idea too, is like if your doctor or midwife had said, oh, I'm not really comfortable with that, and then there's a different person who's working with you when you're actually in labor, maybe ask them because maybe they'll say yes.
100% I agree.
Oh, and other person that can go both ways. Your doctor might have said, yeah, sure, I'm totally cool with that. I can do delayed cord clamping. And then you end up at your birth and this new person you're dealing with is like, oh no, I don't do that. You're not getting delayed cord clamping today. And you're like, yeah, but Dr. So and so said yes. Just because they work in the same hospital or just because they're in the same practice does not mean that they're going to have the same way of looking at things and doing things.
That is true. I will also say too the importance of bringing the birth plan to your provider to have them sign off on it because I have seen before. I've worked in OB for 14 years, and there are some call groups that are formed by like different private practices. Like they're not generally doctors who work together in the same office, but they're like maybe independent practitioners that kind of all join together to cover call, and and I've seen on-call providers treat patients differently depending on who their provider is.
Hmm.
So for example, let's say Dr. A, generally is pretty low intervention and Dr. Z is high intervention. I've seen the doctor, the on-call doctor think to them like they don't want to have to answer to Dr. A if
Hmm.
they broke their water, right?
Hmm.
So because they're going to give report to that doctor
Hmm.
afterwards, so they're like, oh, I'm going to let patient A, she can labor for as long as she wants, I don't care. But they know Dr. C breaks everybody's water, so they're going to go and break Dr. C's water,
Hmm.
patient Z's water, right? Because
Mm-hmm.
that doctor always, and so even if you it's not probably more often than not, having a different person in the call group doesn't guarantee that you'll get the call the same care that your doctor would have given you, but I
Mm-hmm.
have on more than one occasion seen it help. So
Hmm.
even having that, that lower intervention doctor, because the person on call doesn't want to have to answer to
Hmm.
why, you had this, that, or the other intervention. So
Mm-hmm. Yeah.
good to know.
Cool. So last question for tonight is, and you've gone through this, so I think, well, we'll talk about it. I want a home birth, but my husband is nervous about it, so we're planning a hospital birth. How do I know which hospital will honor my birth plan? And then, furthermore, how do I still try to convince my husband?
So I didn't actually. When I asked Paul if we could have a home birth, he said, "Oh, I'm surprised you didn't ask for the second
Oh,
one."
right.
but but because that's because he's married to me,
Right, right.
and his brother and his sister-in-law had already had two home births.
So he was used
So
to it.
we always joke
Right.
that my in-laws were like, "Oh, yeah, that's just what you guys do now, right? Like you wear your babies in these funny carriers and you have your babies at home, right? They have such a skewed idea."
Yeah. 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 Yeah.
But no. So what would you say?
Um, so when I'll answer the first part of that first, like if you want a home birth and your partner doesn't, what I have noticed over the years is that 95% of partners is my estimate. There's no research on this as far as I know. My
This
estimate
is
is
not
95
scientific.
my estimate is 95% of partners, if they meet with some home birth midwives and ask them all their questions of what they're nervous about, I would say 95% of them will be like, "Oh my gosh, yeah, totally. We can have a home birth. That totally makes sense to me now." Because they've had their worries addressed. And then there's
Yes.
still a 5% that's like, yeah, that all sounds cool. I'm still a little nervous. So how about we have the first baby in the hospital and then the second baby we can have at home? Or maybe we don't have a home birth, but we have a birth center birth. Or maybe we don't have a home birth, but we switch to a different hospital that we've now learned is going to give us more of what we wanted, right? So I think at least meeting with some home birth midwives, and there's a vastly different, there's lots of different types of midwives that generally practice similarly as far as safety, but they have different personalities, and you're going to find the ones that resonate with your style. And I think oftentimes it's really surprising how many partners are like, oh, I didn't know that you guys could do A, B, and C. I didn't know you guys could resuscitate a baby. I didn't know that you're monitoring the baby and you're going to transfer to a hospital if necessary. I didn't know that my partner who's pregnant is considered low risk, so that her birth is very likely to be very normal and we're not really scared about it. We don't need a NICU, most likely. And if we do, we'll transfer, but that's really low percentage chance for that. And then sometimes you find out that you are labeled high risk for a good reason. Being in a hospital is the best place for you.
Yeah.
But I'm going to shoot back to you. How do you know if you have to plan a hospital birth because your partner's still uncomfortable about a home birth? How do you know which hospital will honor your birth plan? Which is sort of related to our last conversation, but still, like bringing that home birth twist to it. What do you think?
Bringing that home birth twist to it. So great question. So I'm just going to kind of tie in. It's a great way to end the show. Many of the things we've talked about in class on the podcast today. So researching cesarean section rates on the internet for your hospital. Researching and touring maybe a couple different hospitals to see if they have the type of amenities that are helpful for non-pharmacological pain relief, like readily available birthing balls, squat bars for the bed, tubs and showers that are in every room or that are in more than one room. Considering hiring a doula, considering laboring at home for as long as possible, and asking around to other people who have had, babies at those hospitals or with those providers, and what their births were like. That can be another way to try to figure out which hospitals might be the best and most likely on a birth plan. These were all such great questions, Jeanette. I'm so glad we did this, and I'm looking forward to our next episode when it's all about lactation and breastfeeding.
Yeah, that would be really good. I'm hoping we get some more questions, but we've already got plenty of them. So we can talk about birth and breastfeeding for hours and hours and hours. And that's what we typically do in our classes.
I know. We've got to cut ourselves off.
But we love it. We love it. We love it. So we hope you'll visit babiesincommon.com/show to view all our previous episodes and see what we have coming up. Our show, as always, is available as a video recording as well as a podcast on our website, as well as Spotify and Apple Podcasts. We would love reviews. We need to work on getting more reviews. So please, if you're listening, give us some reviews. And visit our website or Facebook page to learn more about our groups, classes, and services that we offer, as well as occasional tips through the different posts that we have there, because we're all hoping to support you as you are working to plan your birth and rock your birth and thrive as a new parent. And as always, Babies in Common is a community for you. After all, we all have, as we always say, babies in common.
Babies in common.